In fact, where fluoride actually came from is it's a byproduct of industrial society. So aluminum foil production, a major byproduct of aluminum foil production is fluoride, and one way to get it legally handled as far as the toxicity of it is to basically convince our government back in the 40s and 50s that it was necessary for tooth health and preventing tooth decay, and it should be put in the water. And that way it went from being literally considered by our government a hazardous environmental toxin to somehow safe for human consumption. It's really, really crazy, and that was based on absolutely no solid research at all. Fluoridation's role in the decline of tooth decay is in serious doubt. The NIH funded a study on individual fluoride ingestion and tooth decay and found no significant correlation. So what they have found is that even in areas where they stopped fluoridating the water, the tooth decay rate did not go up. And so what they have found is that it's less an indication of whether or not your water is fluoride based, or it's more an indication of the health of that community overall. So cleaning your teeth every day, flossing your teeth every day, good dental hygiene practices, and good healthy eating. And so what we find is that, again, it goes back to lower income areas tend to have more tooth decay regardless of whether or not the water is fluoridated. So it is not the fluoride that prevents or causes the tooth decay. It's what you're eating, how you're eating, and are you taking care of things? Do you have access to good dental care, basically? Which is a real shame, because we still, like I said, 180 plus million people in the United States are getting fluoride in their water every day, showering in it, bathing in it, consuming it in their sink water. So tooth decay is high in low-income communities that have been fluoridated for years. So it's not the fluoride, obviously, that's preventing it. Tooth decay does not go up when fluoride is stopped. Tooth decay was coming down before fluoridation even started. So according to data from the CDC and the World Health Organization, which you can find those graphs on fluoridealert.org, it will actually show you that tooth decay was going down before fluoride entered the picture. And again, it was because of better hygiene practices and better access to good foods, quality foods. Let's see. Dental fluorosis may be an indicator of wider systemic damage. So dental fluorosis is an over-fluoridation of teeth, and it's happening in children. Sometimes it happens in kids that are using a lot of excess toothpaste, like we talked about the CDC warning about, fluorides in antibiotics. So if a child has had to have multiple rounds of antibiotics for things like ear infections and is drinking tap water, brushing the teeth with fluoride, you can get an actual fluoride toxicity reaction where the teeth will actually discolor permanently and turn brown. And so now we have a kind of what we're trying to prevent from happening, caused by the fluoride itself. Fluoride will damage the brain. It has been shown in research that fluoride actually lowers IQ. It lowers visual acuity, so it can affect vision, and it calcifies the pineal gland, so it calcifies glands in the brain. It literally is a contributing factor to Alzheimer's and dementia. Fluoride affects the pineal gland, like I mentioned, affects the thyroid gland. Fluoride causes arthritic symptoms. So we have people that are complaining of arthritis, random joint pain, fibromyalgia, may be diagnosed with various types of non-autoimmune arthritis. It may actually be a fluoride accumulation that's causing this, because it is toxic in the body and will build up. It damages bone. It can increase hip fractures in the elderly. And this is a major cause of death in the elderly, is actually a hip fracture. Only half of the elderly that have a hip fracture will actually survive because of the damage that's caused to the blood supply in that area. And so fluoride may be a major contributing factor to this. So I hope you enjoyed this part of our fluoride hazards, dangers, and toxins series. Please join us for the next part.